thank you, Milton, for having me, and I'm really looking forward to introducing you all to the MAVEN Project. The MAVEN Project is a nonprofit healthcare organization that works with an enormously rich group of physician volunteers who volunteer their time and expertise, and we connect them via telehealth technology to clinics around the country that serve our nation's uninsured and underinsured via telehealth technology, which is powered by VSee. And we're so grateful for the partnership, and you'll see how we leverage the technology to really bridge these parties. Our founder, Dr. Lori Green, who, if you're from San Francisco, she has either delivered you, your children, or your grandchildren, or all of them. She's delivered every baby here in San Francisco. Was the president of the Harvard Medical School Alumni Association several years ago, and was running a meeting one day and was charged with how do we engage the alumni in something meaningful. And at the same time, around the passage of the Affordable Care Act, was keenly aware of the growing sort of access to health insurance that we might be providing some of our citizens, but yet access to healthcare was still going to be a challenge. And the light bulb went off for her, which was, could I connect, when she was running this meeting, a group of the doctors sitting in the room in front of her as volunteers across various clinical specialties and connect them via telehealth technology to serve those around the country that really need access to care, and really to support those at the front lines delivering care to our nation's most vulnerable. So one of the facts that I like to sort of lead with is something that I didn't know until joining the MAVEN Project, which is here in this country, we have a 20-year life expectancy gap between the wealthy and the poor. That's here. And in fact, I was presenting in DC this summer, and within a 1-mile radius in Miami-Dade County, there is a 15-year life expectancy gap between the wealthy and the poor. So we have a lot of work to do here. So the MAVEN Project, I told you what we do at a high level, and I'll get into a little detail, but it's a little bit of a mouthful, but it stands for Medical Alumni Volunteer Expert Network. And our goal really is to do the following with our services. Number one, to really support the frontline primary care providers through resources that help improve their wellness and decrease their burnout around the country. Number two, increase access to care for patients that ordinarily don't have access to specialties for which they need to manage their conditions, their chronic conditions. Number three, to improve health outcomes. And number four, to really avoid the escalation of cost that's burdened to the patient, to the family, and to the health system. So just a quick snapshot of who are our volunteers. So we have physician volunteers that currently cover 42 clinical specialties, including primary care disciplines, family medicine, internal medicine, pediatrics. They originally were recruited through medical school alumni associations. Currently, we have relationships with many of the medical school alumni associations, Harvard, Tufts, UCLA, UCSF, Stanford, the list goes on, Cornell. We also recruit from professional associations. PBS NewsHour featured us, and that brought some of the most wonderful physicians to us. We also have volunteers for which we didn't realize they have family members that are also physicians. So we actually have identical twin sisters that we didn't realize one had a twin sister that was also a physician who was a volunteer for us. But these are all physicians who are looking for a meaningful way to give back. They're looking for a way to use those muscles that they've developed their whole career in a flexible way. And many of them are either tapering their clinical practices or are recently retired. So we're taking a workforce that's diminishing in this country and reinserting them in a really meaningful way, both to them, they find the experience really rewarding, and to those that they're helping, their primary care provider partners in the clinics we're working with, and the patients that they're caring for. And our job is to make a community for them. So we also have in-person gatherings, virtual gatherings, committees for them, and they find it a nice way to create a community for themselves. So what do? So we do 3 services that together really support the frontline primary care provider that's caring for our nation's most vulnerable. Number one, we provide clinical consults. So through our telehealth platform, a primary care provider can schedule or can connect with a specialist live and discuss clinical cases. It can be a single de-identified clinical case, a group of cases, or a general kind of population health approach question. The average time that a connection takes place is around 15 or 16 minutes. So these are often quick questions, but also some of the consults can last an hour because our volunteers do have that time and they're able to really discuss the art and science of medicine and of the questions that are being asked, and they're really there to train and to educate. So the goal is to really increase the knowledge capacity at those at the front lines and give them the tools they need to really optimize the patient's care and to really feel professionally satisfied and competent. We're also adding in soon sort of an asynchronous e-consult feature as well. The consults generally happen individual, one-on-one, but we also are doing them in a group setting. So a clinic might bring all of their providers together and discuss a couple of complex neurology cases, and we'll bring in virtually one of our neurologists to discuss the cases. The second one are educational sessions. So a clinic will come to us and say, we're struggling with how to manage complex diabetic patients. We want to learn a little bit more about opioid management and depression in teenagers. And so we'll develop custom educational sessions. We have probably 60 or 80, maybe more, sessions that have been delivered to date, but also if there's a topic that hasn't been delivered, we'll deliver that. And we'll offer it to the whole clinic virtually, and then we open it up to all of our other clinic partners as well. We have continuing medical education credits, currently a partnership with the UCLA Geffen School of Medicine, so we're able to tag CME with many of these sessions. Again, the goal here is to increase the knowledge capacity of those at the front lines. A popular topic is the ABCs of EKGs. So if I don't read EKGs every day, how do I really get myself more comfortable and familiar with reading those? And the third one is mentoring. So we actually pair our volunteers on a one-on-one basis with frontline primary care providers. They meet twice a month virtually through the Telehealth platform. And the goal there is to give them the professional supports they need to enable them to be successful as a practicing provider. They can discuss clinical cases, but it's really around how do I feel and become successful managing a complicated day? How do I have time, figure out time to make a phone call, go to the bathroom? Believe it or not, if they can't figure that out, they're going to burn out and they're going to leave, and then we're going to get into this nasty cycle of recruiting and retaining primary care providers in the clinics around the country. So this has been very, very successful, looking at provider wellness, decreasing burnout. We are also doing this at the clinical leadership level. So we are taking physician executives and pairing them with the medical leadership in these clinics to give them the tools they need to effectively manage their practices. So some quick, fast facts before I've run out of time. I discussed we have over 42 clinical specialties. We're currently in 9 states and expanding. We do have work here in California. We have over now 86 clinic sites, really focused on free clinics and federally qualified healthcare centers. Again, we're powered by VSee, thanks to the wonderful partnership we have. We were featured on PBS NewsHour, and a couple of other fun facts about our founder is really playing a pivotal role in San Francisco healthcare landscape here, and we've been published in a bunch of places. Last piece around our impact data that we're really proud of. So for these clinical consults, so 43% of the time we find that a clinical question that comes up helps the primary care provider really affirm their care plan. I just want to run this by you. You've done this and seen this a million times. Does this make sense? The second one is 76% of the time they're actually able to also help augment the care plan. Add something, consider adding this or taking away this. And then for me, some of the most powerful data is that 82% of the time, when we ask this question to those that respond to our survey, we are able to avoid a referral for that patient who ordinarily would have been sent out of that clinic. And for our clinic partners, a referral may mean a 6 to 12-month wait, or it may mean a wait forever. The access to care for access to specialty care for this population is exceedingly limited, and it's magnified by payer, by geography, et cetera. And then 82% of the time, really, the consults provide education to the primary care provider that they can apply to future patients. And then the average experience rating is very high with our volunteers. They're this amazing wealth of knowledge. So just one, we call it the multiplier effect, and we're working on quantifying this, but one example of a clinic partner that we have is that they had a consult about a complex diabetic patient. And the volunteer provided education around, here's how I would think about this kind of in general around diabetes management, and now let's talk about this patient. And when asked afterward, he said, I can apply that education to every one of my diabetic patients that comes in next. So I asked, how many diabetic patients do you see? 150. Out of how many patients? 800. So now one probably 20-minute consult is enabling him to manage differently and better, more informed, almost 20% of his population, his panel. So I'm just out of time, but really our solution, we really think, really aligns with the quadruple aim: improving health outcomes, decreasing or avoiding cost, improving satisfaction for the patient, and really providing satisfaction for those at the front lines providing care. And then when you partner with us, you get access to all of the services that we've described: the educational sessions, the consults, the mentoring program, and a liaison between our organization and the clinic as sort of the day-to-day go-to. And we're looking for folks to join us. And I will take questions now. Thank you.
Lisa, how are you financially supported?
It's a great question. We are primarily funded by grants and philanthropy. For clinics, there are some clinics for which they are able to contribute to the operating costs of delivering the services, but the majority of our funding is from philanthropy and grants. Yeah.
Great.
Hi, thanks. Really interesting. My question was whether you found that on the receiving end, the free clinics and those places, the providers have any issue accepting being helped by someone else, in the sense of, I'm a physician, I should know this, and does that create some kind of difficulty, or has it been easy to deal with that part?
That's a great question. I'll answer that in a couple of ways. I will tell you that the nature, it's magnified in the mentoring, but the nature of having independent experts at your fingertips does diminish the barrier in many ways to asking for help, because I think there's some stigma around, if I ask someone in my clinic, are they expecting me to know something? So we do, one of the things when we're doing orientation is we say no question is too small to ask. So we do find that diminishes the, I would say, any barrier to participating. Early on, we did find that some providers, when you read the bios of these physicians, they're incredible. They might have started the field of whatever. And so they felt like they needed to have everything perfectly baked in order to present the case. And we're saying, no, just come with your raw question. Because if it's perfectly baked, you may have missed some questions. You might have we might have wanted to get different labs even before, we went to the next step conversation. So we really encourage folks to ask early, ask simple. You can ask complex as well, to really diminish any barrier they have to asking. But like any new initiative, there is barrier to getting any, you have to find the right partners who are ready to take on any new initiative as well.
Lisa, thank you so much for the
Thank you.
wonderful, wonderful talk.
Thank
and
you.
all your great work.
Well, thank you. I feel like